and climate change science from the University of Abuja. And his profession began in 2005 at the Nigerian Meteorological Agency, and he currently serves as a technical assistant to the Director General of the Nigerian Meteorological Agency. So thank you so much for joining us and agreeing to speak to us, Dr. James. So I'll give you the floor so that you can speak to us. Thank you so much.
Thank you, Helen, and thank you, everyone, for joining this meeting. I'm glad to be here discussing this very important topic, which is the most important topic globally now, and talking about the El Nino and its effects on and impact on human and particularly gender perspective of it. Now, just to take you through those, I know you've read, you've heard, you've listened the current discussion globally about El Nino, and some people wonder what is this El Nino. Now, El Nino basically it's is one of the ENSO, that is the El Nino Southern Oscillation, which is a key climate driver that affects one of the major key drivers that affects the climate of globally. Now, when you look at El Nino, what it means is that within the Pacific, where there's a teleconnectivity with what is happening in the Pacific, particularly where scientists have mapped out known as Nino 3.4. But when you look at the Pacific Ocean, there's an area around the Pacific within between 170 to 120 western degree 5 and degree north. That area has what happens in that area affects the global circulation. Now, this El Nino, you've been hearing it about graphs and things, but the main topic today is how does it affect us? Now, if you look at food and nutrition security, for example, one of the key drivers to food and nutrition insecurity, the main driver, natural causes, which is climate extremes. And this climate extreme is driven by what is happening recently, talking about the Pacific Ocean, the warming of the Pacific Ocean, and bringing about extreme events globally. And how does it affect us in Africa? I'm trying to give a human face to it. Now, what it means to West Africa, where I'm from, it means within the Sahel, there'll be a reduction in rainfall. And the extreme we'll be having in the Sahelian region of West Africa is we'll be having extreme droughts. That means there'll be dryness, and livestock and human, including availability of forage, will be affected. Then when you look at other parts of, because the teleconnectivity differs from region to region. Then when you go to Eastern Africa, where my colleague will speak about, it talks about probably increased precipitation and extreme event like flood. Now, when you have an El Nino event, like such the ones we're having now, which is being termed Super El Nino, and as I checked yesterday, the current reading is about above normal, is about 2.7 degrees above normal. Now, projecting it's already warmer than 0.5, and we're already on the El Nino phase. And what it means now, when you look at the key drivers of food and nutrition security, and I'm trying to look at it from the human angle and the gender aspect. Now, it affects food availability, because if there are extremes, particularly drought or flood, depending on the teleconnectivity with your region, it will bring about it will affect the availability of food. That means it will affect production. Once it affects production, then food will not be available, both for human and also feed for livestock. Now, that is one. Two, accessibility. Now, if there's a major drought or major flood, it affects access to food, the physical access, either bringing it from farm or taking it to the market, and it affects the price. Now, economic access. Now, when there is a reduction in production, that's availability, the price goes up. And who suffer most? For our rural and smallholder farmers, we look at even the women. You need to get food and livelihood for your family, because you are the homestead. Now, if there is availability is affected, it even affects the nutrition at home. With children on the 5 and lactating mothers, you find out that it affects including their health. Then you look at utilization. If there is this shock, either extreme event or either flood or drought, it affects the nutrition, the home level, at household level, the nutrition in that area. So utilization, because if there is flood, it affects the water, and if it affects water, it will bring about waterborne diseases. So food utilization of food will be affected, and general stability of the whole ecosystem. So that is how we look at it, as from the climate to impact and human. So there's El Nino, and it means either extreme events, either flood or drought in your region. Then it affects availability of food. Then it affects livelihood, because for those that are in the agricultural value chain, mostly women, either processing or marketing, if it affects the availability, then you find out that business begins to die down. It affects the livelihood of that community. So just to just give you a key, as I told Helen, I am in the field, just to give an opener. Looking at El Nino, what it means the warming of the Pacific Ocean, and that warming of the Pacific Ocean has a teleconnectivity with our region, depending globally. So depending on your region, to some region it means drought, to some region it means flood, to some it means early onset and late cessation, to some it means late onset, early cessation. That means the production, the crop cycle or the season becomes shortened, and it affects the dry spell or wet spell, either increased wet spell or increased dry spell. And when this happens, those are the extremes, then it affects availability in terms of food and nutrition security, accessibility, utilization, and stability. Just to cap up, and I want to stop for here, so that my other colleagues can come in, then we continue the conversation. Thank you.
Okay, thank you so much, Dr. James. Before we allow our other colleague to join in the conversation, I'd just like to know, now that we already know that the prediction is strong that the El Nino is going to come soon, I'd like to know, from the perspective of Nigeria, and especially where you work at the Meteorological Organization, are there any national strategies that have been planned to help cushion the women that you've talked about, or the economic side of it, or even just to ensure that by the time El Nino comes, people will not lack the food, as you've mentioned that food insecurity is one of the major human aspects that are going to be one of the impacts?
Okay, thank you. So as a country in Nigeria, we have we have set up the Anticipatory Action Group, where we set up triggers. As the National Met Agency, we have defined those triggers, and we are working with partners, that government leading, with some development partners, so that we'll be able to, first of all, advise within, particularly this season that we're going into, where we're anticipating for us late onset, early cessation, and reduction in the rainfall amount. So we work with the Ministry of Agriculture to preposition or to make sure the availability, using research, of drought-tolerant variety, which is a kind of anticipatory action for the upcoming El Nino, so that we put these things in place. We are also working with those in the livestock industry, so that we start looking at areas where you have pastures and pasture availability, where you start making some kind of haze and stack them, and getting these things available. Also, remember, Nigeria is large. I'm looking at the northern part of Nigeria. The southern part of Nigeria, what it means, there will be enhanced rainfall and some level of flood. So we are also, for example, we have worked with the research institute, and they've developed a flood tolerant rice and maize variety, which can, if there's a flood and there is after 15 days before the water recedes, the crop will not die if it stays underwater for 15 days. So such varieties have been shared among, the Ministry of Agriculture is working with partners, and also we're encouraging those in the rural community where they can access those varieties. First of all, the theory of change, people still have this, they still are having doubt about these things, but we keep preaching it and taking it around. And we are working with the National Center for Disease Control, because we are experiencing extreme high temperatures, so that they too also through radio jingles, so that women and children that are likely most impacted by this will be able to bring some, they'll be able to preposition some medication and set up centers. And we advise people, the general public, to reduce the number of time they spend outdoors because of this heat stress. And particularly, let's try and if you must stay outdoor, probably get a shaded area to do your business. I want to stop here. Thank you.
Thank you so much, Dr. James. I like that you, or rather your government, is working in collaboration, not just, let's say, the Ministry of Environment, but they're also working with the Ministry of Health, where you say that the National Disease Control Council are also anticipating for the impacts of El Nino by setting aside the medicine, and also the Ministry of Agriculture by ensuring that the rice that is planted that is resistant to the floods. And I think that is, or should be, the way to go, that we do not work in silos, but work together as different ministries in anticipation for such events. Thank you so much. We'll come back to you later, and thank you for joining us even while in the field, and we appreciate your time. So unless there's any other person who may have a question to Dr. James specifically on what he has presented on, I think this would be a good time to ask the question. If not, we can ask him later. You can type your questions in the chat and I'll be able to read and ask on your behalf if you're not in a position to speak. Okay, then that means Dr. James was very clear, but in case of any questions, he'll still be around and he'll be able to respond to that. So we will swiftly move on to our next speaker or panelist, and that is Hannah Kimani, who is the head of public weather services at the Kenya Meteorological Service Authority in Kenya. And she supports the sub-seasonal to seasonal forecasting section, where she contributes to the production of forecasts ranging from 2 weeks to seasonal timescales. Professionally, she's a climate scientist with over 20 years experience. That's a lot of experience. And she holds a bachelor's and master's degree in meteorology from the University of Nairobi, as well as an operational training course on certificate in meteorology from the Institute of Meteorological Training and Research. Thank you so much, Hannah, for joining us this, is it now evening? And we welcome you to speak to the topic that we are discussing today. Thank you.
Thank you so much, Helen, and I hope I can be heard. Please confirm that I can be heard.
Yes, you can be heard clearly.
Yeah, thank you. I'm so privileged to be here, and I did not come alone. I am accompanied by 3 women from the Kenya Meteorological Services Authority, and I would wish to acknowledge them. Dr. Pamela Kaituru, who I think will have, if time allows, will give us an overview of what she does in matters climate and mental health. I'm also accompanied by Rinian Wanyiri, who works at the Institute of Meteorological Training and Research, and Madam Cyprus Nyadinda, who works in one of our sections that monitors atmospheric pollution. I will go straight to my presentation, which is on the screen. And I'll ask the lady to go to the next slide. I think I'm placing a lot of emphasis on women because when these weather and climate shocks hit, women are not do not suffer the same as men. So we are saying that El Nino is not gender neutral. The climate event is likely going to be the same, but its consequences are shaped by women's access to land, finance, information, healthcare, technology, decision-making, and social protection. I think I'll explain this further if I get the time. And a research by Food and Agriculture Organization showed that around 60% of working women in sub-Saharan Africa are employed in agriculture-related fields, and there's a link to that research there. And as we're preparing to move to the next slide, we know that in our continent, women in some culture are not allowed maybe to have access to land. And this means that they are not able to cope or even to invest in agriculture-related activities or any other activity that is carried out through land. And I think my colleague has already talked about El Nino, which I want to just say it is a climate pattern across the Pacific Ocean. I think he has already explained that. And it has three phases. We have the El Nino, which is what is our concern today. We have the neutral, the normal phase, and the cool phase. And what we are saying is that El Enso changes the global atmospheric circulation, which in turn influences temperature and precipitation across the globe. And both are associated with extreme and climate events in different areas and different seasons. Both last about a year. It can be shorter or longer. And their El Nino is characterized by what is called a positive relative oceanic Nino index. And it has to be greater than or equal to plus or 0.5 degrees Celsius. And for it to be classified as a full-fledged El Nino episode, these thresholds must be exceeded for a period of at least 5 consecutive overlapping 3-month season. So I want to clarify while we are still here that El Nino is not rainfall. It's just a phenomena that changes at the precipitation and temperature patterns. And in East Africa, as I'm waiting for the next slide, in East Africa, El Nino is mainly associated with above average rainfall during the October, November, December rainfall season, but it is also associated with depressed rainfall of from June to September in parts of Eastern African region, and we'll be able to see that in our subsequent slides. So El Nino is classified as weak, moderate, strong, or very strong. And I just want to insist here that the term Super El Nino does not exist under the El Nino classification. And this is not the first time that we'll be having a very strong El Nino, because the 2026 one is forecasted to be a very strong El Nino. You can see that we had a very, and remember, for very strong El Nino, the temperature normally has to be greater than or equal to plus 2.0. And you can see in 1972, 1982, 1997, and even 2015, we had very strong El Nino. So the key message here is that we are supposed to understand the climate drivers of our respective regions or countries to be able to fully understand the impacts of El Nino. And in East Africa, we'll be able to see again in this slide that in East Africa, we have also another driver that is called the positive Indian Ocean dipole, which is basically associated with warmer than average ocean temperatures over the Western Indian Ocean and cooler than average temperatures over the Eastern Indian Ocean near Australia. So you can see on the very first slide here, we can see the negative relationship between El Nino and rainfall over the East African region. You can see all the way from Western Kenya, Uganda, Ethiopia, Sudan, and even South Sudan, El Nino is associated with depressed rainfall from June to September. But now from October to December, El Nino, which is the middle slide, El Nino is associated with above average rainfall. And that is why you are seeing a positive relationship between El Nino and rainfall over the East African region during the October, November, December rainfall season. The map on the right shows you the effect or the relationship of the positive Indian Ocean dipole with rainfall over the East African region. And you can see that the color is very deep, meaning that the red color is very, very deep, especially over Kenya, Tanzania, Somalia, Southern Ethiopia, and even these parts of Eastern Ethiopia. It tells you that a positive Indian Ocean dipole is highly correlated with above average rainfall from October to December in the East African region. And the most intense rainfall have been experienced when both phenomena occur together. That is when you are having El Nino and a positive Indian Ocean dipole. The next slide will show us how this has the effect of both in the East African region. Just using, I'm only using 3 years. I excluded 2023 because it was not a very strong El Nino. It was only a strong El Nino. So in 1997, we had both a very strong El Nino and a very strong positive Indian Ocean dipole. And we see we got very high amounts of rainfall, especially over Eastern Kenya and even parts of Somalia. In 2015, we had a very strong El Nino, but a weak positive Indian Ocean dipole. We did not get as much rainfall as compared to 1997. And then in 2019, we had a very strong positive Indian Ocean dipole. We did not have El Nino, and we still experienced high amounts of rainfall over most parts of the region. That is why I'm saying it is important to understand the climate drivers in our respective countries and in our respective regions. Moving on to the next slide. This is just an example to emphasize that El Nino is not rainfall. It is just a phenomenon that alters temperature and precipitation. You can see in different parts of the world, where you are seeing brown is where we are having depressed rainfall in different seasons, and the green shows rainfall or enhanced rainfall in different parts of the world. In Africa, you can see that from November to March, South Africa experiences dry conditions or even what you would call drought. And also from July to September, this region here experiences dry conditions or drought, just like my colleague from West Africa has said. But on average, El Nino is associated with warmer than average temperatures. Moving on to the next slide. Why then are we talking about women and the effects of El Nino? Women are disproportionately affected by extreme weather and climate events. And this category has pregnant and lactating mothers, we have young girls, we have elderly women, we have women with disabilities, and women who live in informal settlements. So one key question that we should be asking ourselves is, are our preparedness systems designed around how women actually experience weather and climate risks? And the next slide is just an example showing how extreme weather and climate events affect women. On the top right is a girl, a school girl actually in uniform, struggling with desert locusts. And this shows you just immediately after school. The one in the middle shows you a woman whose house has been completely destroyed by floods. Then here shows women who are queuing for water when we are having drought conditions in most parts of maybe Africa or even East Africa. And then top left is an example of an informal settlement that is experiencing flood. And inside here is a house, inside the house of a lady in an informal settlement. This is just to appreciate how women are affected by extreme weather and climate events. Moving on to the next slide, we have what you're calling the gender multiplier. There's the climate shock. There is unequal access to resources, including early warning information, then that leads to unequal impact. I just said about land and asset ownership that constrains women's ability to recover or even invest in adaptation. We have limited access to information. We know that in some cultures, women are not even allowed to have radio or telephones or even TVs. So this means that even when early warning information is being disseminated, they will not get access to this information, or when even if they have access to these gadgets, when the early warning information is being disseminated, they are busy in the kitchen or taking care of their families, so they don't get access to this information. The fact that social and religious norms prohibit women from making decisions or even taking actions even adds to the problem. You are a woman, you know that a flood is coming, but you're not allowed by your culture or your religion to even take action. When we come to displacement, economic stress, and safe water, shelter, and environments, this also can increase protection and gender-based violence risks. We move on to the next slide. So these are a category of impacts, not just to women, but across all genders. But now, I want us to go to the next slide. I don't want to read all of them. I want to go to the next slide and see how this affects various sectors where women are involved. Let's look at fisheries, for example. We have lake backflows, water recharge. This lead to loss of income. And say, for example, women are busy selling fish, then a flood comes and destroys all that they had. This will lead to loss of income. And so what we need to do is to look for alternative livelihoods, and even market access, ways to protect these fish from being destroyed by floods. When you come to transport and infrastructure, what does damage to critical infrastructure does? It leads to increased travel time or lack of access to health facilities. You can imagine a pregnant woman who is being taken to hospital and a flood has cut off the road. What does that mean to this woman and her unborn child? So what do we need to do then? Offer alternative routes and transport facilities for women and women who are at risk. When you come to agriculture and livestock, my brother just talked about how drought and floods can lead to crop or livestock losses. This means that you lose your losses. I mean, you incur losses, and so and we also have food insecurity that disproportionately again affects women. So what do we need to do? Provide seeds, finance, extension, and veterinary services to women. When you come to water, scarcity of water, be it through contamination of floods, means that there's more time for collecting water for women. So what do we do in a nutshell? Provide safe, reliable water to women. When you come to health, we've seen that El Niño increases or leads to warmer than average temperatures. So things like heat, disease, nutrition, because of maybe food scarcity, leads to maternity and reproductive health risks. So what do we do in a nutshell? Have these services accessible to women. Education, school disruptions. Girls often they drop out of school, especially during drought or even floods. So what do? We ensure safe continuity of education for girls. When we come to humanitarian displacement and protection, what do? Women, especially those the women with disabilities, you're in a position where there's floods and you need to be evacuated. Then the person who comes to evacuate you is maybe a man. Then in the process, he may sexually abuse you. That will lead to pregnancy, unwanted pregnancy, sexual transmitted infections, including HIV. So how do we do in a nutshell? We provide safe, modern shelters and global-based, gender-based violence services. I could go on. I just want to talk about governance. Women have an equal voice in all aspects of life. So what do? We involve women in decision making. That is in a nutshell. I now want us to go deep into a few sectors. So when you look at agriculture, the main aim is to protect women's livelihood and not just crops. So what do? We can enhance climate smart agriculture like minimum tillage. We can adjust planting dates based on forecast. We can diversify crops and varieties depending on the extreme event that you're dealing with. Then we can put in place measures to protect livestock through provision of water, feed, veterinary services, and even movement planning. If you're expecting drought, a woman has maybe a few livestock. How can we ensure that our livestock will be moved to safer places? We can continuously monitor and control pests and diseases that are associated with these extreme events, especially like now in East Africa, where we are expecting warmer than average temperatures and above more rainfall. There's that risk that diseases may increase. We can strengthen post-harvest storage and market access to reduce losses again in East Africa during a positive ocean dipole. The rains extend into January, where it's time in these places. So we need to strengthen these post-harvest mechanisms so that we avoid losses. We expand access to climate information, extension and finance, insurance and digital tools. How do we do that? Is by like, for example, ensuring that women get the right information that they need to be able to deal with these extreme events. Empower women to own and have control over productive assets and participate in farm level decisions. I just said again, in some parts of Africa, women are not allowed to own land and even to make decisions. So we need to make sure that they are empowered to do that. When it comes to health, including reproductive health and protection, let us prepare for heat stress by providing cool places in areas where we would expect extreme heat and safe drinking water. We can promote water sanitation and hygiene. We can preposition essential medical supplies, including mosquito nets, and provide referral and transport plans. I just give an example of a woman who can't access, who can't even go and deliver in a safe hospital because roads have been cut off. We also need to map the most vulnerable, especially pregnant and lactating mothers, elderly women, and women with disabilities, that so that we know if these events are coming to will happen, what do we do, or where do we need to go. And we can also integrate gender-based violence through prevention, survivor-centered response, and safe reporting into disaster plans. So the key message here is that a resilient health system should be gender responsive before, during, and after the extremes. Moving on to the next slide. I want us to look at education because it is very key, and we all know that you educate a woman and you educate the whole nation. So we need to put in place school-community emergency plan and early warning channels. We need to identify safe alternative routes to school. In East Africa, we've seen cases where children can't go to school. We need to support girls to continue learning through radio, phone, or alternative methods if schools close down because of the extreme events. We also need to provide food, water, and sanitary care to girls, especially during the extreme events. Provide designated safe learning spaces. I cannot overemphasize on the need to put in place measures to deal with gender-based violence and ensure that girls are safe. We need to seek school fee, food, transport, or social protection support where available, and ensure that girls participate in decisions, not just about rebuilding schools or even returning to school. Ensure that they take part in decision making. Moving on to the next slide. Transport and infrastructure, we need to keep women moving safely throughout the disaster. And for women, transport is not simply about moving from one place to the other. It is about access to income, education, healthcare, market, and safety. I do not want to go through all the points, but I want to talk about safety emergency transport. You can save emergency transport money where possible as a woman. We need transport operators, especially the government, to identify vulnerable routes and plan diversions. Again, I will keep referring to my example of that pregnant woman or lactating mother who has a sick child and cannot access a health facility because a road has been cut off. We should also prioritize safe transport for pregnant and lactating mothers, girls, older women, and women with disabilities. I want us to move to the next slide because of time, and I want to give us enough time to ask questions. So what we are saying is that we need to move from forecast to early action. So what do we need to do first? The most important thing is to warn the population. So we are saying that we need to reach women early in accessible languages, channels, and formats. We have women with disabilities who cannot read the conventional languages that are used to disseminate early warning information. So we need to find out how do that information get to them. We need to translate this forecast into local livelihood risks, and we can do this by combining hazards, exposure, and vulnerability. And we cannot do this alone. We can only do this through co-production. We need to set clear triggers and responsibilities. At what point do we act? Who is going to take this action and at what time? Again, we embrace the issue of co-production. And in East Africa, we have what's called the Greater Horn of Africa Climate Outlook Forum and the National Climate Outlook Forums, where we bring in stakeholders from all climate sensitive sectors, the community, and we co-produce these impacts and advisories together. In East Africa, we had this last week in Kigali, and in Kenya, we had it, we concluded it yesterday, and in other countries in East Africa, it is ongoing. Then we need to act. Preposition cash, water, medical supplies, food and non-food items, seeds, and we also plan for social protection. And we need to do this before disaster hits. That is what we call in broad anticipatory action. Then we need to collect sex, age, and disability disaggregated data and for us to be able to adapt. And that is what we call embrace gender equity, disability, and social inclusion approach. So, and that is why I started by saying that women are disproportionately affected. So what can we as women do before, during, and after El Nino? Stay informed. Get the forecast alerts and advisories from reliable sources. We have the regional centers and we have the national centers. And in some countries, we have the sub-national centers. Get information from them. Get into adaptive social protection if possible and available. And that this is where I would allow the government to work together with development partners to be able to have this in place. We can diversify crops and income. If you're where you are, El Nino will cause drought. Look for drought-resistant crops. If where you are, El Nino will lead to above average rainfall, you can work with agricultural extension officers to be able to maximize on crop production by planting the most appropriate seed. Then we need to store water and food and be aware of evacuation plans. During El Nino, continue following official alerts and updates from reliable sources, avoid flood waters, protect your dependents, especially children, secure your livestock and assets where possible, and do not make them a priority. Make your life a priority and move to safer areas to be able to protect yourself. After, you need to document what your losses are. If you have if you are able to access any relief and social protection, do that. Rebuild and diversify your livelihoods if what you had is completely gone, and then replant or recover where appropriate and participate in recovery decisions. We move on to the next slides. We as women cannot prepare for El Nino alone. We need a combined responsibility. So for the governments, we need to ensure that we have gender responsive early warning, social protection, and resilient infrastructure and health systems. For the financial institutions, offer affordable credit, savings, insurance, and emergency finance to women. For the private sectors, provide worker protection and safe working environments for women. If a woman comes and tells you that she wasn't able to come to work because maybe her house was swept away or maybe there was no access to transport, please do not sack her. For the non-GOs, CSOs, CBOs, and NCOs, enhance community preparedness, women's networks, protection, and last mile communication. For the communities, including men, plan and implement local contingency plans and meaningful participation of women. For the women organization, co-design, monitor, and lead locally relevant preparedness actions. For the media, disseminate weather, climate, and early warning information responsibly. So preparedness should be co-produced with women, not just designed for us. So we are saying there is nothing for us without us. So before I conclude, I want to say that we need to remember these 5 actions that we need to, 1, get actionable actions to women early, protect safe water and sanitation, protect livelihoods, enterprises, and income, protect health, education, food security, and safety. And most important, put women in climate and disaster reduction decisions. So I think I've finished with my slides. Now, there is one last one, call to action. So call to action, we are calling upon policymakers. We are asking them, are our El Nino plans gender responsive? For these organizations, including the Met Services, the media, the CSOs, and FBOs and CBOs, are we ensuring that women are receiving impact and actionable forecast early enough to act? For the communities, I cannot overemphasize on this. Are women participating in decisions about preparedness? The goal is not only to protect women from climate shocks, but to remove the barriers that prevent women from leading resilience. Thank you so much. And if time allows, I will invite, if time allows, I would want to invite Dr. Pamela, before even we do questions, to just give us an overview of what she's doing with her with our climate and mental health issues. Thank you so much.
Thank you so much, Hannah, for that elaborate presentation, which has been so enlightening, I must say. And time allows, so Dr. Pamela, you are allowed to speak. Please take the mic. The floor is yours.
Okay, and good afternoon. I believe all of us are in an afternoon. Thank you, Anna. Thank you, colleagues, for allowing me to speak. I really want to applaud Anna for the good presentation around gender and the El Nino preparedness. And I want to echo the fact that El Nino is not only a climate event, but it's a human and development, health, gender, and mental health crisis multiplier, because it is really going to impact people. It is about the people that it will affect. So as she has stated, I work with Anna, and besides meteorology, I did psychology. And out of research, we were able to identify the gap around the climate action that leaves out the aspect of mental health of the population, the affected populations. We know that out of the implications of climate change, the extremes that people are experiencing, even now that we are talking about El Nino preparedness, there's a psychological component to it, because the extreme events will definitely lead to fear, hunger, shame, a lot of instability and dysfunctions that potentially will influence or trigger mental health issues. It leads to anxiety and depression and other psychological distresses. Then grief that communities experience, not only women, but men, children, youth, the elderly, then the people living with the disability. They experience grief due to the loss of their livelihoods, loss of the family members, loss of their livestock. And of course, because of occurrence of extreme weather over and over, like when we look at the Greater Horn of Africa, we have experienced consecutive droughts. Places have experienced floods consecutively. There's always the post-traumatic stress disorder that comes after those extremes. The uncertainty, as for now, when the forecasters are talking about expecting an El Nino, those who experienced the El Nino of 1997, 2015, as Anna has said, they are already finding themselves worried. They are anxious. What will happen? We are told to move to higher grounds. Where are these higher grounds? And when you move to the higher ground, of course, you live in a displacement camp or something like this. It disrupts the normal living condition of a family. And that, of course, causes a lot of disability, even for the families. There is likely to be gender-based violence. And of course, sexual gender-based violence also occurs, and these all trigger mental health issues that complicate health and well-being. When we look at the aspect of women and children, it is so real, but also we should also consider the aspect of men. Men are known to be kind of like the providers of the families. They are the ones that the families are looking out for, maybe to fend for them as the head of the family. Now, when these losses occur, it is leading to loss of identity. I look at work that I have done within the pastoral communities, and especially a community called the Maasai, which is cutting across Kenya and Tanzania. You find that cattle for them means identity. So when you lose your cattle, there is the loss of identity. There is the shame of not being able to provide. You have lost a voice amongst men. There is the financial pressure that the family puts you in. You are not able to provide. Of course, This causes a lot of emotional instability. It can lead to a lot of irritability, conflict at the family level. All these are indicators of mental health issues. So as being an advisor into an organization called African Coalition of Communities Responsive to Climate Change, which I think Hannah will share the link to some of our work. We have been able to do work in Kenya, Uganda, and Ethiopia as a regional NGO. And really, we have been able to identify there is a strong link between mental health and climate extremes. And as we speak about the expected El Nino, there is need for organizations, for countries, for communities to plan around mental health response. Prevention is always better than cure. We know that globally, 1 out of 8 people live with a mental illness when we look at the WHO mean data that is available. But even these people are not able to get support because the infrastructure for mental support is not there. Besides, there's a lot of stigma around mental health issues. How many psychologists are working within communities? Eventually, you find people not getting to be identified, those who have indicators of mental health, until they develop psychiatric conditions that require medication. So we need to really invest a lot in prevention, and this can be done by a lot of empowerment at the community level, being able to strengthen systems, our health systems, our community systems, to identify the mental health issues that are climate related. And even as we do prevention, also treatment, care and management of the people with mental health issues. We know mental health issues cut through an extreme, mild, moderate, and severe. So if we can be able to identify earlier, then we will be able to put proper systems as governments and development partners, so that then we reduce the disease burden in our communities, because we know it is a health issue. It is a sustainable development issue. This responds to goal number 3, goal number 13. It links also, of course, to the goal number 5 on gender equity. So it is a developmental issue, and I think it is important that we curate solutions around mental health issues, even as we think climate response. I wish to maybe stop there and say that you can find a lot of our work on www.accrcc.org. You will find us on LinkedIn as African Coalition of Communities Responsive to Climate Change. I think we need to interact more and be able to see how we can really put communities at the center of the response, so that we reduce the disease burden within our communities. Thank you.
Thank you so much, Dr. Pamela, for the work that you do in the intersection between mental health and climate change. And before we go back to Hannah to ask some of the questions that our listeners have, I just have a question for you. Is there anything that you feel is a gap in terms of the response towards mental health when there's a climate risk or like climate disaster that awaits, like El Nino, to that breadth, based on the work that you have done so far? I know you said that mostly the studies that you've done were mostly done at the pastoralist community. So beyond that, because I know the El Nino impact goes beyond the pastoralist community, have you seen any mental health gap that you feel governments need to respond to?
Thank you so much. Yes, there is gap, as we have seen. El Nino will impact even the urban areas of our communities. The gap is that as you see response being done, the humanitarian institutions, the governments, the community, always the aspect of health that is covered is the physical health. We are saying mobilize medicine. Let nurses, doctors be in place to respond to diarrheal conditions, to malaria, to chikungunya, respiratory diseases. But what of the mental aspect? Are we preparing psychologists and counselors? You always find that that is a population, or those are professionals that are left out when it comes to interventions. And that is a big, big gap. The other aspect of the gap is, are we documenting these mental health implications? Because, you know, the problem with the mental health is that often people will think for a person to develop a mental health condition, it has to be extreme. But it's about the functionality of the person. If this person, because of the impact that they have experienced, they are becoming dysfunctional, there is deviant behavior, they are living dangerously, you know, there is distress. These are things that we need to be able to address before they graduate to mental illnesses, because at the end of it, everyone will experience stress. But if we don't build resilience, then we'll have an increase in mental disorders that, of course, have a bidirectional relationship with the physical illnesses. Because one who has a mental illness likely will not be able to take care of their health, even feeding nutritional-wise. They will likely develop another non-communicable disease like high blood pressure, diabetes, or looking at a person who has developed another health condition because of malnutrition. When they start getting anxious, somebody died in their family because of maybe diabetes, of high blood pressure. Now they have developed high blood pressure, they are getting anxious, and it triggers a mental illness. So we need to be able to have understanding of the holistic health of a human being and strengthen our systems. So that is a gap that we have really identified.
Thank you so much, Dr. Pamela, for that. Dr. Hannah, I see there is a question for you in the chat, but I've responded to it. But for the sake of maybe someone who wishes to understand it better, what really is the difference between El Nino and La Nina? And Rashida is the one who asked this question, and they wanted to know if these terms can be used interchangeably or are they different in any way?
Thank you, Helen, and thank you, is it Rashid, for asking the question. No, they cannot be used interchangeably because they mean two different things. And like I've explained in the chat, they are opposite phases of what you call the El Nino Southern Oscillation. El Nino Southern, we call it El Nino Southern Oscillation because it is not just the oceans that we look at. We also look at the atmosphere. So when say for example, the ocean temperatures are getting either cooler or warmer than average, the atmosphere has to respond. The atmospheric variables also have to respond, and that is why we have the component of southern oscillation. So during El Nino, we tend to have warmer than average ocean temperatures, or what we call in our language sea surface temperatures, over central and eastern tropical Pacific Ocean. If need be, I can share what we mean by Central and Eastern Pacific. And then over Western Pacific, ocean temperatures become warmer than average. And that changes the precipitation and temperature patterns across the world. During a La Nina episode, which is now the opposite, so El Nino, we call it the warm phase of the El Nino Southern Oscillation. Now, La Nina is the opposite, cool phase of the El Nino Southern Oscillation. So during La Nina, the areas that had warm or warmer than average ocean temperatures now get cooler than average ocean temperatures. That is the Central and Eastern Pacific. Then over Western Pacific, where we had cooler temperatures during El Nino, now the ocean temperatures become warmer than average. So it is an exact opposite of what happens during El Nino. So we cannot use them interchangeably. They are two distinct features and they are opposite. But both are associated with extreme events in various parts of the world. And of course, you have to consider other drivers. And that is why I said you need to understand the climate drivers in our respective countries or in our respective regions. I hope that is clear.
I think that is clear, Rashida. I hope that is clear on your end as well. And maybe just, I see she has had her thumbs up, so it's clear on her end. Just a follow-up to that question. I know you've talked about the ocean and also looking at the atmosphere in order to classify whether there's an El Nino or a La Nina. But I want to understand why the Indian Ocean and Pacific, or are there any other oceans that they are also looked at, whether they are warming or cooling? And if not, why these two? And also, if you can explain what you mean by the Indian Ocean Dipole for the layman audience that is here.
All right. Thank you. Thank you again, Helen. So I think I should start with explaining why the Pacific and the Indian Ocean and not the Atlantic Ocean. Basically, the way we are speaking with one another, oceans also speak to one another. And they speak to one another through something we call teleconnections. And because we have said that it alters actually what happens during El Nino or La Nina, or let's just stick to El Nino for the sake of, so that we do not confuse our listeners. What happens to El Nino is that when El Nino is happening, there's usually a change of wind direction. Direction, or either what we call the trend winds either shift direction or they weaken in direction, and that is what pushes the water to the cooler waters into the Western Pacific during El Nino. So these teleconnections make now the Indian Ocean again to respond to what is happening over the Pacific. The Pacific Ocean is the largest ocean in the whole world, and it controls a lot of activities in terms of weather and climate. And that is why what happens in the Pacific affects the Indian Ocean. In most cases, when we are having El Nino, we always have a positive Indian Ocean dipole. And allow me at this point to explain what a positive Indian Ocean dipole is. A positive Indian Ocean dipole is mainly characterized by warmer than average sea surface temperatures over the Western Indian Ocean. The Western Indian Ocean is that area, the ocean near the East African coast. That is what we call the Western Indian Ocean. The Eastern Indian Ocean is to the extreme of the East Indian Ocean, and that is south of Indonesia and near Australia. That is what we call the Eastern Indian Ocean. So when you're having warmer temperatures over Western Indian Ocean and cooler temperatures over the Eastern Indian Ocean, then we say we are having a positive Indian Ocean dipole. And I explained before that the most intense rainfall over East African region tend to occur when both are in phase. We have a positive Indian Ocean dipole and we are having El Nino. However, El Nino does not always lead to a positive Indian Ocean dipole. Sometimes a positive Indian Ocean dipole will develop on its own. And I gave an example of 2019 when we had a very strong positive Indian Ocean dipole, actually the strongest ever on record, and we ended up having a very heavy rainfall in our region. So the oceans, in a very layman's language, oceans tend to speak to one another. Having said that, the Indian Ocean and the Pacific Ocean are not the only oceans that affect rainfall patterns or temperature patterns. We also have the Atlantic Ocean that also tends to contribute different ways to the weather and climate patterns that we experience, but is in no way related to El Nino. Atlantic Ocean affects weather in its own way, but not related to El Nino. I hope that is clear, Helen.
Yes, that is very clear. And thank you so much for even the presentation that you had earlier about the different sectors and why we need to include women as part of the conversation that we have in terms of El Nino. And I remember one thing you said is that the goal is not just to protect the women from climate shocks, but to remove any barriers that prevent these women from having the resilience to survive in such a setting. Thank you so much. You had mentioned there's one more person who you joined with. I don't know if they're going to. If not, we will introduce our next panelist.
Helen, that will depend on your time. If we have time, Lillian and Cyprus can just say hi so that we can move to the next presenter.
Okay, they can just say hi and what they do and maybe how they can contribute to this conversation, and then we'll move to the next presenter.
We can start with Lillian. Lillian, kindly. I don't know if she's still in the call or she left. Is Cyprus still in the call?
Hello, everyone. My name is Cyprus Nyadida, working in the Kenya Meteorological Service Authority. I work in the section of air pollution monitoring. I'm happy to have joined my colleague Hannah in this well-presented presentation about El Nino, and we are happy what she's doing. Thank you.
Thank you so much, Cyprus, for that. If time allows, we will give you the opportunity to speak about the work that you do in regards to air pollution, because we know that affects women as well. If not, maybe we can organize for a different session and we'll be happy to have you join us. Lillian, are you able to say something?
I'm not sure she's still in the call, Helen. For the sake of time, maybe we can move to the next one. If she comes in, she will just say hi.
Okay, no problem. All right, thank you so much. So our next panelist is Esther Muriuri, who has over 10 years of experience in disaster risk management, and her expertise spans across anticipatory action, emergency response, preparedness, disaster risk reduction, and policy engagement. She has worked across diverse rural and urban contexts in Kenya, the United Kingdom, South Sudan, and Ethiopia. She holds an MSc in Intelligence, Security, and Disaster Management from the University of Derby, and a bachelor's degree from the University of Nairobi. She's currently pursuing an MA in Environmental Planning and Management. Thank you so much, Esther, for joining us, and you can take the mic, and we are happy to have you here.
Thank you, Helen. Please confirm you can hear my voice.
Yes, I can hear you loud and clear.
Thank you very much, everyone, and good evening. So maybe if you can go to the next slide, Helen, please. So I just wanted to highlight a little bit about the El Nino as a risk multiplier. As we know, and probably already mentioned by Hannah and the previous speakers, El Nino as an event is a climate phenomenon, but the humanitarian consequences depend on the vulnerability of the communities and also the preparedness capacities. So in particular, when we are looking at the East Africa, most of the cases, El Nino coincides with the OND season, that is October-November season, which is quite a significant season for certain countries, particularly Ethiopia, Kenya, and Somalia, where we see this season contributing to 70% of the total annual rainfall. And from what we see is that most of the cases, and Hannah mentioned already, the El Nino mostly is associated with above normal rainfall. So we are likely to see an increased risk of flooding, flash floods, landslides, and some disease outbreaks. Next slide. So when we look at the current projection for the OND season, there is a high likelihood of above normal rainfall, as you can see from the ICPAC projection for the Greater Horn of Africa, with some exceptions of certain locations in Sudan and South Sudan where it is expected to receive depressed rainfall. So here I pause a little bit and say, at this point, the question is really not about how strong the El Nino will be, but also what risk this El Nino is likely to create in the specific countries or regions where we expect above normal rainfall. So when we look at the vulnerabilities of the communities who are exposed or at the risk of flooding or the impacts of El Nino, we are looking at different types of vulnerabilities spanning from poverty levels, conflict, displacement, environmental degradation, limited access to basic services such as health and water, sanitation. So this El Nino condition creates a multiplier effect to already existing vulnerabilities. And we see that because of this, most of the people or most of the communities that are at high risk or vulnerable are people living near flood-prone areas, people with maybe in degraded lands where you don't have strong healthcare system. There's likelihood of compounding effect of floods, which can lead to disease outbreaks and so forth and so forth. Next slide, please. So when we talk about El Nino and the need for different agencies to prepare, we are looking at what are the likely humanitarian impacts, or what are the likely human impacts that can be that can lead to either loss of life or injuries. And some of the risks or impacts we are looking at are related to floods and landslides. So most of the times in areas where you have flood-prone areas, you have degraded lands, people live along the riparian zone, for example, or you have structures cannot withstand, or structures that are not flood-proof. We are likely to experience damaged homes, damage to critical infrastructures such as road networks, bridges, schools, and sometimes health facilities and water infrastructure. Another impact is around food security. And particularly for this region, we are looking at, especially this year, we are looking at certain community or certain regions, countries are currently coming out or will be coming out of drought conditions. Some parts of South Sudan, some parts of Ethiopia. And at the same time, we are looking at an El Nino impact that will likely cause flooding in the same communities. So when you look at the food security, it's both from the flood impact that is associated with the El Nino event, but also the dry conditions coming from the current season we are in. So in this, we are likely to see unmet needs on food security, especially because of the compounding nature of the floods and drought and how they interact. So this is will be a quite interesting season to see how we are able to manage the risk associated with these two phenomena. The other impact is on health, and on health is on two ways. One is that there will be likelihood of increased diseases related to waterborne diseases like malaria. We are also looking at cholera outbreak, for example, and other diseases that are linked to cold climate or cold weather. But also we know that whenever there is floods and landslides, health facilities are damaged or accessibility is limited. And most of the people who are mostly vulnerable here could include pregnant and lactating mothers, children under the age of 5, elderly people, but also people living with chronic illnesses. So this is also one of the likely impacts of this season. Then when we look at water and sanitation, we are looking at likelihood of contamination of water sources and even disruption of water services. And this mostly, I think, from the experience that we had this year in Nairobi, beginning of the MAM season, March, April, May season. There's also this likelihood that, if you have floods, this can interfere with the existing water infrastructure. Next slide, please. On displacement, yeah, it is also likely that people living on the flood-prone areas will likely be displaced, moved temporarily to evacuation centers, or even permanently, as we have seen in certain regions where water has inundated certain places and has refused to recede with time. Then we are looking at the protection issues, and Madam Pamela talked a lot about issues of psychosocial support or mental health, which is one of the unmet needs when it comes to disaster response interventions. And mostly when we talk about protection issues, we are looking at female, children. We're also looking at elderly people and the caring responsibility that comes with this section of the community. Then when it comes to livelihood, and also this is an area that most of the time it is overlooked, especially in the beginning of the response. When we look at the impacts of El Nino, it does not only impact the human and the physical infrastructure, but it also affects crop farms, for example. It disrupts market or even damages markets, and creates constraints for active productive income. The last flooding that happened in Nairobi, for example, we saw a lot of businesses being damaged, and a lot of entrepreneurs or business people went into a huge loss. So this is also an area that could have high impact. And education center as well, we look at it in two folds: damage to the school infrastructure, but also cut off of education system as well, either due to inaccessibility, but also most of the times because most of the areas that are affected lack specific evacuation centers. Most of the schools are used as temporary shelters. So this is also an area that we see most of the times when you have this impact, that education system is highly disrupted. But I would like also to note that the interaction between the hazard, which is the flood, and also the exposure and vulnerability would vary between different communities, and this will be influenced highly by their level of preparedness and also investment. Next slide, please. So when we talk about acting ahead of El Nino impacts, or those impacts that I have mentioned, I think we are at a great position to do that compared to a few years ago. Most especially because at the moment within the Greater Horn of Africa, we have improved forecasting capabilities, which can offer communities with adequate and more accurate information to enable them act ahead of extreme weather events such as this one. So, for example, ICPAC, which is the IGAD Climate and Prediction Center, provides seasonal forecast and other forecasts, short-time forecasts, to the Greater Horn of Africa membership, which gives an outlook of how the season will look like. In addition, the different countries, for example, the Kenya Meteorological Authority here in Kenya and other agencies like hydrological agencies, they provide also in seasonal forecasting, monthly forecasting, up to even daily forecasting information that can provide communities and humanitarian organizations and disaster management organizations with good forecasting information with different lead time to enable them act ahead of the impacts or before the impacts are felt. But this does not happen without deliberate action or deliberate willingness, commitment to translate this forecast into early actions. And this is where everything makes a difference. At the moment, we know that most of the regions or some of the country, most of the communities or different regions within Ethiopia, Kenya, and Somalia will experience above normal rainfall. But what will make a difference is what we do with that information. At the same time, I want to highlight that we have also progressed quite well in understanding that anticipatory action, this is using forecasting information or predictable information to act ahead of the disaster impact, saves lives, is more dignifying, and also offers an opportunity to reduce the disaster losses. And in this area, there has been a lot of progress in developing frameworks and also financing mechanisms that can support disaster management authorities to act ahead of disasters. So I wanted to highlight a few examples on what can be done. I try to split this into long lead time, that is between when we receive the forecast to when the impact of the forecasted event is felt, and also the short-term lead. So for the long-term lead, and this one I'm looking mostly as seasonal forecasting, is to ensure that we are able to disseminate this information to communities at risk in a simple and understandable language and materials. So, for example, most of the forecasting information comes with very complex language, with graphs, for example, with maps that communities or farmers or pastoralists cannot be able to interpret. And this is where practitioners like myself and other agencies play a big part to develop key messages that is palatable for different groups within the community. The other action is to strengthen community-based disaster risk reduction. This is quite important because most of the time we forget that disaster risk management is a collective responsibility, not only for the governments, but also for communities also at the individual level. So if we are able to invest a lot in community structures, educate them more about the risks that are involved and what they can be able to do to reduce the impact, then they can really greatly improve the outcomes of a forecasted event. And some of the things they can contribute to would include even to improving drainage system, or even they can contribute to the flood management interventions brought either by development partners or the government. Also, other intervention would include protecting water sources and strengthening the water sanitation and hygiene systems, particularly to ensure that we reduce the exposure or the risk of cholera outbreak and other waterborne diseases. Then supporting farmers with climate information, especially so that they know what type of crops do they need to plant for this season. Do they need to adapt? Do they need new varieties? And what type of agricultural practices do they need? And this would also be applied, for example, to the livestock farmers as well. What kind of health interventions do we need for livestock keeping? Then other things that, because we cannot really prevent all, we cannot prevent the El Nino from happening or the floods from happening, then we need to, for example, plan for areas that might not be accessible by prepositioning essential items that will be required. This can include medical supplies, can include essential household items, food and such, etc. Then for schools, also strengthening school infrastructure and other critical infrastructures as well, and also doing testing and evaluation of evacuation and safe shelters. Then next slide, please. Then when you have short time lead or shorter lead time, especially when you have a month, 2 weeks forecasting, then you don't have a lot of time to do more mitigation actions. Then you can really intensify and prioritize life-saving interventions that would include dissemination of early warning information and evacuation information. For example, you would have already mapped out where the evacuation centers would be, and this would be a good chance to inform communities where to go. Then also it can also include cash assistance, which can go into helping communities move or self-evacuate to the designated evacuation centers or shelters. But it can also include, for example, simple activities within their community, like maintaining drainage system, such as gabions or even dike system if they have, or even reinstating their homes. Then evacuation of community productive assets as well. This can also be covered either through direct support, but also you can also do cash assistance to help communities move their livestock. Also provision of water treatment supplies, hygiene education. This would really ensure that you reduce the risk of waterborne diseases before the impact of the El Nino is felt, and communities have better information ahead of time. Then when it comes to healthcare facilities, ensuring that it is stocked with essential medicine supplies, but also reinforced from impacts of flooding. Also putting in place search and rescue teams. For example, I saw in Nairobi, there was also interventions from different stakeholders with boats to rescue people who were stranded. So this can be one of really life-saving activity or intervention to do. Preparing emergency shelters, ensuring that there's also some protection of critical infrastructure. Like I have seen, there's efforts to clear drainage system and ensure that there's clear flow of water systems. And lastly is also what I say is a personal plan. It is everyone's responsibility as well to be aware of their situation, to make use of the weather information that is produced. For example, Kenya Meteorological Authority also produces daily forecasting, and this can really help improve your own plan. Then on humanitarian response, as I had mentioned before, even with good preparedness and anticipatory action or acting ahead of the predictable hazard, not all impacts can be prevented or fully reduced. So there will still be need for humanitarian response, and this can include search and rescue, provision of emergency shelter, food and essential household items, water, safe and clean drinking water, and even sanitation facilities, especially for communities that are displaced. And also support of emergency health services, protection and psychosocial support, and also as long-term, including the recovery and rebuilding aspect, which can include long-term projects that focus on livelihoods or food security, or even wash interventions to increase the water supply and accessibility by the communities. At the heart of this will sits the coordination and collaboration, which is really key to ensure that all this is possible, especially between the disaster risk management agencies, the forecasting agencies, but also other stakeholders who play a different part. So in conclusion, I wanted to say that especially with the forecasting that we have for this season, it is really best that we act on the forecast and invest on a no regret approach, so that we don't wait and see the impact, and that's when we are running. Then the second point is to prioritize the most vulnerable. As I mentioned, there are different vulnerabilities and they change with time. So it's always good to ensure that we are always doing this risk assessment to identify who is really in the need of assistance. And The third point is investing in preparedness, particularly because when you prepare, you have the right skills in time, you have the right financials with you and the plans, it is easier to execute the plans. So lastly, I look at the El Nino season this season, even though the forecasting and the predictions look quite worrying. I view this as a potential opportunity to also demonstrate how much progress the Greater Horn of Africa has made when it comes to proactive disaster risk management, especially now with different frameworks that have been put in place, different capacity building and information that we have from the forecasting agencies. I believe this would be a good opportunity to showcase that and ensure that the people are well protected. Thank you. Over to you, Helen.
Thank you so much, Esther, and also for ending on a positive note, because we are told that solutions journalism is the future of journalism. And I know there are a number of journalists who have joined the call, and you can reach out to the experts that are here so that they can explain to you some of the solutions that they have already put up in place, so that we don't just report about the El Nino with the lens of saying that there's a disaster looming, but also showing that, yes, there's a disaster looming, but we have these solutions that are coming up, and there's evidence that these solutions have worked, and we can report about that as well. I like it when you say that it is not how strong the El Nino will be, but the humanitarian response. And the humanitarian response, now that we have the early warning systems already in place, what will make a difference is what we do with that information, because most of the time we are told maybe to move to higher grounds. We are told if it's drought, we are given different early warning systems, but we just don't do anything with that information. So our work as journalists is to inform the people, our readers, to do something about the information that maybe the Kenya Meteorological Organization shares or the Nigerian Meteorological Organization, so that they can have this knowledge and understand. So the floor is also open for questions to Esther, Hannah, and Dr. Pamela. I don't know if Dr. James is still here, but if you have any questions that you'd like any of the panelists to respond to, the floor is yours. I see no questions on the chat box. And if there's no question, maybe I'll just give each panelist, the ones that are still around with us, to give us a parting shot based on the anticipation of El Nino that is about to come, and just a general overview of their presentations. I'll start with Hannah.
Thank you, Helen. Maybe before I do my parting shot, I see Lillian has come back. If she could just say hi because of time.
Good evening, Anna. I was always here. By the time you called, there was some background distraction, so I wouldn't talk. So my name is Lillian Wanyere. I am an instructor at the Regional Training Center for Meteorology, otherwise called Institute of Meteorological Training and Research. So it's good that we are talking about impacts, climate information. And so I encourage that we purpose to also come and train with us. We do organize short courses, which may be tailor-made, and you'll be able to build capacity on meteorology and climate science. Thank you very much.
Thank you, Lillian.
Thank you. Please go ahead, Hannah.
Yes, I was thanking Lillian. My parting shot is that it is not all gloom. El Nino also comes with positive impacts, like we can look at the potential of maximizing agricultural yields because of the above average rainfall. So let us prepare, let us not panic. let us continue following updates from all our national meteorological services and even the regional climate centers. They are all over Africa. We continue following their updates and we take them seriously because climate change is here with us. Even though El Nino is not part of climate change, it's part of climate variability. Climate change is making these events to be more intense and very frequent. So we'll continue updating the public all over Africa, not just in East and Western Africa, all over Africa. So we ask all our listeners and our viewers, our followers, to constantly follow our updates, both on TV, radio, and social media pages. Thank you so much, and it was a pleasure to be part of this webinar. Thank you.
Thank you so much, Hannah, for that. Esther?
Thank you so much, Helen. So for me, my part in short would be, like you said, it's everyone's responsibility to be aware of what is happening within their surrounding. So I would also encourage everyone to look into information that is coming from the Met Service, for example, but also from the disaster management agencies and organizations. They offer very good and life-saving tips on what to do in case you find yourself in a flooding situation, for example. And also, if you're able to break down this complex information into simple, understandable information to your family members, to your community, local community, I would encourage you to do that, because it is our responsibility all as one community to look after each other. And lastly, thank you so much for giving me an opportunity to share my experience with everyone. Thank you.
Thank you so much. Dr. Pamela?
Okay, I want to also appreciate for this opportunity to speak to us and say, even as we anticipate the El Nino, it is important to realize preparedness should go beyond just the forecast information, to look at the human consequences of the El Nino, that will include also identifying the psychosocial or psychological and gendered vulnerabilities of the various communities, so that then we ensure that the mental health issues, the psychological issues are dealt with before, during, and even after the El Nino is gone. We see that it's gonna have overspill in the early of the next year. So we have a bit of things to put in place before. At least we have some lead time, but even during, response should be intensified, and after, especially so, knowing that mental health issues are slow setting, but yet very that may have long-lasting effects and implications to the other aspects of lives and well-being of our communities. So I want to appreciate also for the opportunity to speak to this great team and look forward to more engagement. Thank you.
Thank you so much, Dr. Pamela. I think we are 10 minutes past the time we had set to end our conversation this evening, but I'll give praise who has been helping us behind the scenes setting up this call, to just have a word and then we will close. Thank you so much for joining. Once again, my name is Helen Shikanda. I'm a health and climate reporter based in Nairobi, Kenya. Asanteni.
Thank you very much, Helen. Thank you very much. My name is Praise Apple. I am the communications lead at EcoWomen Media. I sincerely want to appreciate us all for staying till this point. I mean, my deepest gratitude goes to our speakers. When I reached out to Dr. James, Miss Hannah, Miss Esther, they were so excited to speak on this, and I for one, have gained a lot from this webinar. Thank thank you to every participant. You will get the webinar recording and the speaker slides in your emails. Putting this webinar together along with the EcoWomen Media team has been really wonderful. So you can look forward to more opportunities like this, more events, insights. I have dropped a link to the EcoWomen Media website in the chat box, so you can just go through and see all the stories that we've published. I've also dropped our social media handles. And thank you once again. I wish you all a beautiful week and weekend. Thank you. Thank you, Helen.
Thank you and goodbye.
Thank you. Bye.
Bye-bye. Thank you.
Thank you, everyone. Bye.